All right, so I'm going to go ahead and get started. We have a lot to cover today, but fortunately for me, it's not me talking at folks or anyone, much from here at the University of Washington. We have instead some incredibly important guests who will be doing most of the presenting. But here's a little bit about what we're doing today. So I'm Eric Bruns, and good afternoon to everyone across the U.S. So I'm a professor in the School of Medicine in the Department of Psychiatry, but more important, I'm co-director of the National Wraparound Initiative and the National Wraparound Implementation Center, who are also in the house today. And maybe more specific a little bit to today's event, the director of the University of Washington Wraparound Evaluation and Research Team here in beautiful, at least today, Seattle, Washington. So we're so excited for our webinar today because like I was saying, it shows off one of the coolest aspects of our job and our work. It's so cool to be able to be part of a group of folks, including you all across the country. We bring people together. That's our job. National Wraparound Implementation Center and NWI. We are basically, our big picture goal is to bring folks together in the quest to help kids and families. So today, this is kind of represented by bringing together representatives of 4 states, 1 in each time zone, who will be describing some of the critical decisions that they have made around how best to collect and use data on implementation of wraparound care coordination in their states. And so these folks include Tammy Pearson and Lydia Shaw from Marshall University in West Virginia. Michelle Moreno, who told us in our pre-meeting here as we were trying to get organized, you can see how well that went, that she is sometimes referred to as the mother of Illinois wraparound, which I love. But her title is Statewide Wraparound Administrator in the Department of Children and Family Services. Arturo Calderon from New Mexico High Fidelity Wraparound and Children, Youth, and Family Division in Behavioral Health. And finally, Danielle Philips, just down I-5 in Portland, who's with the Center for Improvement of Child and Family Services at Portland State, which also happens to be the home of the National Wraparound Initiative and my colleague, now semi-retired Janet Walker. So these panelists have a few things in common that brings them to us today. So they are all directing efforts to use data to continually improve their systems of care for youth with serious emotional behavioral needs and their families. And they're using one or more of our fidelity measures to do so. These measures include the Wraparound Fidelity Index short form, which is a survey of 4 different types of respondents: youth, caregivers, team members, and care coordinators. The team observation measure, which assesses fidelity and quality of the process through team meeting observations. And finally, the document assessment and review tool, or DART, which does so via documentation review. And if you want more information, Kristen will put a link into the box, but you could also scan the cool little QR code. So they're not only using these tools, but they're also using our relatively new, few years now, data entry and reporting system to both help collect those data as well as then produce reports, track completion of the data collection that they're doing, track youth outcomes. They can download raw data sets, and that system is called WrapStat. So the youth roster that each state produces is intended to be of all youth that are being served by a wraparound. Data from the TOM, DART, and/or WFI-EZ goes in there, and it produces output that is kind of tailored to keep folks on track, reports and other kinds of products that you can then use in your evaluation and CQI work. And so it's important to note that these measures are not just being collected in West Virginia, Illinois, New Mexico, and Oregon, but as we see from our chat, all across the United States. To our best understanding, there's only 4 states in the country where at least one of the tools is not being used. In addition, we're just always so impressed and amazed that 10 years now about after launching the National Wraparound Implementation Center, from my count, the states with the little turtles on them, our NWIC logo, now numbers 20 of states that have received intensive training and technical assistance from NWIC, at least have in the past or are currently, which again, just if I'd known these things were going to be in our future when we kind of got started on this work 20 plus years ago, be pretty impressed. So thanks to everyone for their part in doing this work for kids and families in your state. So it's clearly a national phenomenon, and there are many more examples of states with great evaluation leaders beyond Lydia, Tammy, Michelle, Arturo, and Danielle. But we only have so much time. So today we're giving 4 of them the spotlight to talk about their local approach in their state to collecting and using data to stay on track with their wraparound initiatives. So why are we doing this? So a few reasons. One, because we know that data from WrapStat and these tools can do a lot of things. They can help guide policy, program planning, training, direct supervision and coaching, and help make the case for wraparound quality and outcomes nationally as well as in your state. But we also get lots of questions from those who license the tools, or maybe you're using other tools to evaluate wraparound, which is fine. But with respect to our licensed users of our tools, we get questions like, so how many parents and youth should we survey? How often should we be doing our document reviews? How should we feed the data back? What do we do with the data once we get it? Who should do the observations of team meetings? So lots and lots of questions about the specifics. So we hope this webinar and its recording might be a good resource to others who are asking those questions when they are charged with doing wraparound evaluation and CQI. But in the end, though, the real reason we're doing this is really simple, because we know that we need to know whether or not we are getting positive outcomes and whether we're delivering high quality services to kids and families. And because fidelity and quality matters. A lot of you have probably seen this figure, but the gray boxes are the level of the effect sizes that we are seeing from our data from 16 controlled studies in places that are achieving high fidelity, high quality services according to our tools. And the blue bars show the effects across things like residential, mental health functioning, school functioning, when fidelity is not meeting an adequate level. So we know that this stuff matters, and we need to collect these data to help keep us on track. So finally, we're doing this because we have a vision that all of our wraparound initiatives across the country will have high quality data that they can trust and use, that those data will help improve system, wraparound provider organization functioning, that help families thrive, and that we will all work together, just like we're doing today, to use data to continuously improve the care we're providing to families. So let's do a poll, and then let's get to our panelists. So we are really interested in hearing from you all. And I can't see much because I was told not to show any of my boxes. So hopefully, if there's any big questions out there, Chris will flag them. I'm sorry, I didn't introduce Kristen Vick, who is from our team and who is helping manage our webinar today. So thank you to Kristen while we've launched the poll. I'll also thank Kim Estep and Sarah Strader from the National Wraparound Implementation Center and UConn School of Social Work at the Innovations Institute, who are going to provide a few thoughts at the end of our panelists. So let's take a look at our first poll. Which WFAS tools do you use? We see almost 70% who are using the Wraparound Fidelity Index surveys. Over 40% using the team observation measure. A remarkable, given that we're really only starting to roll it out the last couple of years, good 12 folks on who are using the DART, which is very cool. So yeah, you can feel free to show those results. So we should have said or none, but let's go to the next poll and we'll find out how many folks might be not using any of our tools. Next poll is asking if you use WrapStat, which is the way in which wraparound fidelity data using our tools gets collected. So look at that. The poll is populating. I don't know if folks can see it. While we're getting those answers, Brian, the CSWI, the Community Sports for Wrapper Inventory, is very much available for folks to use. Oh, I see that Kim has answered. Thank you so much, Kim.
And we also have a hand raised, Melissa Hicks.
Oh, okay. Let's finish our polls here. So about half of you are using WrapStat. All right. So for the rest of you, all 4 of our panelists are using WrapStat, and it's a central piece of what they use to collect these data and stay on track. So we'll hear from them a little bit more about WrapStat in their states. And last question. This is a real interesting question. See if you can answer as best you can. Let's launch that third poll. A bit of a, it's anonymous. No one's gonna at your home state is going to critique you for your answer. So last question, drum roll, please. So here's the kind of culminating question that relates to our webinar today and why we're doing it. For those of you evaluating wraparound initiatives, how confident are you in your evaluation plan? Doesn't matter whether you use our tools or not. There's lots of other ways you can get at the critical questions of outcomes, fidelity, quality, satisfaction. But how confident are you in the plan that you have? Seeing a little bit of a trend here. Folks are somewhat confident, maybe pretty confident. People are kind of in the middle. Got a few folks who are feeling really good about what they're doing, a few folks who are not at all confident, and then a whole lot of folks in the middle. All right, thanks for that. That's really helpful and interesting. So let's go ahead to our panelists. We're going to go from east to west and hear from 4 states that are making the vision that we just talked about a reality in their states. And we're going to kick it off with Tammy and Lydia from West Virginia. And please continue to use one of 2 methods to give us feedback, ask questions. If you have a question for one or more of the presenters or for ourselves, type them into the Jamboard that Chris will provide a link to if she hasn't already, or feel free to just type your question directly into the chat. Jamboard's kind of fun. It asks for, you can tile over and put sticky notes in there that ask questions or tells us what some of your biggest problems are. So maybe we can help you all out in the future here at UW-WERT. So let's hand it over to Tammy and Lydia.
Thanks, Eric. Hi, everybody. Nice to see you here this afternoon. I am Tammy Pearson, the Senior Associate Director for the Center of Excellence for Recovery, and do oversight on wraparound fidelity for the state of West Virginia. Lydia, you want to jump on and introduce yourself?
Yes, hello everybody. I'm Lydia Shaw, the TCOM and Wraparound Fidelity Coordinator. So I assist Tammy with coordinating all of the fidelity efforts that we do.
So we're looking at in West Virginia, over 1,500 kids that we have in wraparound. So our efforts are large when we do our fidelity. We are using the WFI-EZ. We use 2 subtypes of that, and Lydia will talk about that here in a minute. And we use the DART, and I'm specifically going to talk about how we staff to do the DART and how we train individuals. And then Lydia will talk about the WFI-EZ. So we can go to the next slide. Oh, there we go. Again, we're from Marshall University, the home of the Thundering Herd in Huntington, West Virginia. That's on the western side of West Virginia, but we do fidelity statewide. So I have staff that are located throughout the state, and some of them are actually located out of state. As we do any of our efforts at Marshall University, not just wraparound fidelity. Okay, so you can go to the next slide. Okay, so I want to talk about the document assessment review tool, which we love to do, because we're doing this tool, and you compare to the WFI-EZ results, is that care coordinators or wraparound facilitators, whatever you call them, don't always know that they're doing it wrong. And you don't always know that they're doing it wrong until you start doing that document review. So when we started, we've done it twice now. And when we did it in 2022, we only looked at 37 families. We had 17 providers. And the state was like, that's just not enough cases, we don't feel like. So they wanted us to look at a larger caseload. So in 2023, we looked at, we pulled 200 cases. We ended up looking at 171 families, and we had 15 providers. So how do you staff for that? Because the DART, we only do at a certain period of time. So you can't have full-time staff that all they're doing is sitting for 9 months out of the year, and 3 months they're doing a DART review. So for us, we cross-train our staff. We use the, we also are over the Transformational Collaborative Outcome Management for West Virginia. So we do the CANs and the FAST and the TCOM tools. And that staff are they're not only trainers, but they also do reviews. So they're real used to doing chart reviews. A lot of them have been WRAP facilitators. Lydia's actually was a WRAP facilitator at one time. So we cross-train all our staff, getting ready to train our evaluation staff who actually assign WRAP cases in West Virginia. So that's what we do. We cross-train everybody so they all know that 3 or 4 months out of the year, they're going to be adding some additional duties to their job, which is doing those chart reviews. We also, though, because it's a big load, when you're doing the DART, it takes, when you're good, once you're good and you've done it for a while, it takes about 90 minutes to do a chart review. So we have to actually contract with staff also. So we did that this year. We contracted with two other individuals that had experience in wraparound. And that was a great asset. We're going to do that again next year. But what you're looking for there are staff that have had some experience in wraparound, but they may be retired. They may be in between jobs. So we were fortunate enough to get a commissioner who was a retired commissioner for the state who actually introduced wraparound to West Virginia. And we actually got a wraparound supervisor who had moved to Florida. So we were able to contract with both of them to do reviews for us in 2023. We can do this because we do it virtually. So we're not going to people's offices and sitting down and looking through a chart. They give it to us. So I'll talk about that here in a second when it talks about documents for review. Training, if you're not familiar with the DART, there's some training you go through WERT, and you have to become certified to do the document assessment review tool. And then Lydia here has put together some training, and she provides support and gave us a booster training if we had been trained in 2022. And then what is so important is meeting the whole group of reviewers meet once or twice a week, maybe even more, to just talk about scoring. How are you scoring things? So we make sure that we're scoring things correctly or consistently across reviewers. We put all our documents in a system. We have a West Virginia CAN system. So our CANs is going in there. Our FAST, our ANSWERs are going into this system. So we said, hey, we already got information going into this system, and some of the wraparound information was already going into this system by one of the funders in the state. So we said, let's create a tab where they can upload their charts and we can review the charts that way. So we're not going anywhere. That's why we're able to contract with people that live out of state. They virtually get those charts through a SharePoint folder. Sometimes, depending on the provider, they're not as comfortable with the CAN system as others are, and we just have them enter data into a SharePoint. So this has really worked for us. We see us doing that again here in 2024. We should have 11 reviewers this time. And we look forward to providing more data to our state and hopefully make some changes to improve wraparound services to the families and children in West Virginia. Now, Lydia is going to talk about the WFI-EZ because we want to get the perspectives of the wraparound coordinators and the families, and that's how best to do is through that WFI-EZ. And we do it a little bit different, so I'm going to let Lydia explain how we do that.
Yes, like Tammy said, hi everybody, I'm Lydia Shaw. So I'll be going over how our efforts in the WFI-EZ differ from possibly some of your efforts. So one thing about West Virginia is it is a very rural state, and our roots are deep in the belief of hard work and really close-knit families. So with that, we brainstormed and we found out that it's probably not best practice for us to send them emails from the WrapStat system. So what we did instead is try to create a strategy for us to be able to have a warm handoff of the survey and also an explanation of the survey from our WRAP facilitators. So what we did, some things that we did is to create kind of like a bite-sized informational video that we created on Beyond, and then we had our wraparound facilitators go to the families and show them this video so that they really can delve into a little bit of the what and the why of the WFI-EZ, so they have some understanding of what's going on, what they're doing, what they're participating in. So also we had our WRAP facilitators have a handout that we had, and on this handout that we had them give to their families was a QR code as well as a link, so that one thing that we know rural communities struggle with is Wi-Fi connection. So knowing that, we know that most people have phones, and what this link and QR code allowed us to do was to allow all of our families to access the survey with whatever electronic device that they had. So with that, we're going to kind of show you the video that we showed our families. Hello, this is a quick guide to Marshall University's Wraparound Fidelity Survey called the Wraparound Fidelity Index short form, or WFI-EZ. While we appreciate any surveys you have completed when starting this program, Marshall University would like to thank you for agreeing to participate in our Wraparound Fidelity Survey, or WFI-EZ. This survey is in connection with the National Wraparound Implementation Center. In this survey, Marshall University is looking at how services are delivered to families just like yours. We want to hear from you about your experiences with the wraparound process. The survey will only take about 5 to 10 minutes to complete, and all information you provide is confidential. It is important to note that your answers will not be shared with your wraparound facilitator, so please be honest with your answers. So how do I access and complete the survey? So your wraparound facilitator will speak with you about accessing and completing the survey. They will send you either an email or a text message that will contain both a link and a QR code to access the survey. If you have any issues accessing the survey using the QR code or link, please contact your facilitator and they will help you as soon as possible. You will need internet connection or phone service to complete the survey. If you do not have either, talk with your wraparound facilitator and they will bring their computer or their phone for you to access the survey. When you open the survey, it will first ask you to type in your family number. Your family number will be provided to you by a wraparound facilitator. This number is how we track each family so that all information given is confidential. Next, you will begin answering questions about the program and services provided to you. Some questions will be answered with yes, no, or not sure. Other questions will ask you how much you agree or disagree with a statement. If you are confused or have any questions while completing the survey, please contact your wraparound facilitator for help. After you've answered all the questions, the screen will tell you that you've completed the survey and there are no further steps to complete. Again, Marshall University wants to thank you for taking the time out to complete our Wraparound Fidelity Survey. Your input is extremely useful in helping us improve the wraparound process for children and families all across the state.
All right, that was amazing. Sorry, apparently it stops the video if I click on any of the other screens, but way to go, Lydia. People have been really impressed with this. Kristen can put a link to the blog post from the NWI where we featured Lydia's video as well, if you ever want to go find it in the future. So, because my tech difficulties leave us a little behind, I'm going to go ahead and move to Michelle. Thank you so much, Tammy and Lydia. So Michelle Moreno is next up from our Central Time Zone and from Illinois DCFS.
Hey, everybody. Glad to be with you today. If you would have told me 24 years ago I'd be here with you, I would never have believed you. So thank you for this opportunity. I'm thrilled to say I'm here with other representatives from Illinois. I'm going to share information about what Illinois DCFS community-based high fidelity wraparound programs are doing throughout the state. So we are serving 200 to 300 youth and their families every year. We're using all 4 of the WFI-EZ subtypes and the TOMS. We're not using the DART at this time. So the information I wanted to share with you today is around how we've set up our evaluation cycles and manage those. Engaging families in the WFI-EZ doesn't even compare to Lydia's video, but I'll tell you what we're doing. And how we're using WrapStat reports and the data to really help us improve our wraparound delivery at both the system and the practice level. And how Chapin Hall, our evaluation partners, have used the information to develop a data dashboard. And I'll share an example of that with you as well. So let's take a look at the next slide where we talk more about our evaluation cycles. So what we found is we have 4 separate agencies in the Illinois DCFS community-based high fidelity wraparound programs. We have some other wraparound in Illinois, and I see my partners are on the call today as well. So glad you're here. But for our programs, we've decided over the years, we started about 7 years ago, that it really takes one person being the administrator of our WrapStat system. And so that's me. And we have also worked very hard with NWI to make sure that our sampling settings are very precise. It took time and it took effort. And so I'll help you skip some of our road bumps and speed bumps and tell you what we found that really works. So we found that making the cycle type fixed so that we're not getting new youth and families added throughout the cycle has really helped with data management and being able to really complete the majority of the WFIs and TOMs that are selected. We've also identified that 3 to 9 months within the wraparound program as kind of the sweet spot to collect information from families. Less than that, they haven't been involved with us long enough, and more than that would probably be okay, but it just seems more manageable with the 3 to 9 months. And then we did some kind of just housekeeping. We like to distribute the WFIs and TOMs evenly across coordinators because you'll see in a moment how we use this for professional development. And then some of just the basics, not including recently closed families just because of the difficulties of reaching out to them and some of the other housekeeping things. We do schedule our cycles on a quarterly basis. And we've learned that it's important to set those cycles at the beginning of that cycle. And I can't set them up for the whole year. So don't think you're being proficient or efficient doing them for the whole year because it messed up our data selection and our sampling. So it was important to establish that cycle the first day of that quarter so that it would be an accurate sampling. So on the next slide, those ways that we've engaged families in the WFI-EZ process. So we really take a multi-tier approach to engaging families in the process. It begins at the moment of first contact with families, talking with them about how we use information and data and their feedback and how important and valuable that is to us. And that we use the WFI-EZ surveys as our way to get feedback from them. So the coordinators are supporting that process from the very first day and throughout. The coordinators are also supporting the completion of those WFI-EZs When the families are identified, the coordinators are notified, and they're actively supporting the family's engagement in that process. We do use emails and texts as some reminders along the way, just using the technology that we have available to us. And we've also found that as far as structure and staffing goes in our program, that it has been really important and critical that each program, each one of our contracted providers has their own quality assurance staff. And they have become critical to our ongoing fidelity. Ratio is 1 quality assurance staff for every 10 wraparound coordinators. And that seems to work for us. We do have one agency that provides a gift card optionally, but we're not seeing any real significant difference in their return rates. So to keep going and respectful of the time of my peers, I wanted to let you know that one of the things I absolutely love about WrapStat and our data and how we're using it in Illinois is through our partners, Chapin Hall, and my friend Brian Shore is here on the call with me today. They've developed a dashboard for us. And this dashboard uses both WrapStat data and some of our child welfare information system data. And they beautifully put the two together so that we can use this data to not only improve at a system level, but also, as you'll see on the next slide, this is where the rubber hits the road and my wraparound heart sings, that we're looking at the fidelity, and we're looking at the fidelity, not just, this is systematic, right? This is our aggregate data across all of the key elements, which I absolutely love that we can just quickly look at this. We also can see it at the agency level. And when it really gets exciting to me is when we can look at it at the individual wraparound coordinator level to be able to help develop professional development plans with them in supervision. And then as teams, we can provide team support. If a team is showing that they're not scoring great in natural and community supports, then we as a state, as a system, we can all work together to support and lift those scores up. So that's the way our community-based high fidelity wraparound is using the data, and excited about the future.
Fantastic, Michelle. I'm going to go ahead and put one question in because I'll bet it's a question that folks are wondering about from all of you all. But what is the role of your QA person to support the process?
Yeah, I can speak to that briefly. So our quality assurance staff are agency employees. So each one of the agencies that are contracted to provide wraparound have a quality assurance staff person. And they're collecting the data, they're following up with the families, the caregivers, and the team members. Sometimes they're making phone calls. We're in Illinois, so we're, like West Virginia, there's some very rural parts of our state. I think there are for all 4 of us on the call today. Sometimes calling families and saying, hey, we've sent this, would you be interested? Do you have just a few minutes? And they actually take their answers right over the phone. And then they'll data enter that into the WrapStat system. So I think they're just kind of willing to do whatever it takes to get the family's voice included in our data.
Fantastic. We will bring other questions we see at the end of all of our panelists, or Chris can feel free to butt in if any of them seem really spot on to our presenters' flow. But otherwise, let's move to the Mountain Time Zone. Thank you so much, Michelle. That was awesome. So Arturo, take it away.
Thank you, sir. Hello, everyone. My name is Arturo Calderon. I work with the state of New Mexico with the Children's, Youth, and Families Department, Behavioral Health Services. And in New Mexico, Behavioral Health Services oversees the implementation of Wraparound, the evaluation of Wraparound, the fidelity of Wraparound. Here in New Mexico, we use 3 tools from WERT, the WFI-EZ, the TOM 2.0, and the DART. And specifically, what I'm going to be talking about is more about lessons learned regarding our implementation of the WERT tools, and lessons learned regarding our evaluation structure. You can go to the next slide. When we started to implement the tools, one of the earlier questions we had to decide was whether we were going to approach the implementation of the tools by assessing everyone, or whether we were going to do sample sizes. And sample size that would be representative of each of our sites. And so we chose that latter. And we chose to implement sample sizes with for all of our facilitators, and having them done through quarterly cycles. And it's worked good, with one limitation for us, that if our sites are not able to actually complete all of their samples in their evaluation cycle, then we may not actually have enough numbers to say we have a good representation of what's going on at that site, and then in turn what's going on across the state. So within that as well, one of the lessons that we've learned, another lesson that we've learned, is that we really need to look at each tool, whether it's the TOM, the WFI, or the DART, in independently of each other. Let me explain what do I mean by that. The TOM, I think, can still work really well through a sample size, through a sample representation. But something like the WFI and the DART, I think you can actually do for every single person enrolled in Wraparound. And as a matter of fact, it may be useful to have a WFI and a DART for every person enrolled in Wraparound. But when we started this process, we kind of looked at the three tools and we treated them equally, like they would give us the same information. And sadly, we were mistaken, and we're learning that, and so we're moving towards changing how we're implementing those tools now. Now, the other implementation lesson that one of the lessons that we've learned that we wanted to share with everyone is regarding administering the tools, like who is going to do it, right? Initially, when we started to use the tools, we here at BHS, our Wraparound team, which was a few of us that did the training, the coaching, and everything else, we were administering that tool, all the tools. And then as we started to grow, we incorporated help from the local sites, from the supervisor coaches at the local sites. And then as we grew more, we actually incorporated the help of our New Mexico Center of Innovation, which was good. I think needing that help was a good sign that we were growing and demonstrating that need. But one of the things that we needed to address was this thing about inter-rater reliability, right? The more we grew, the more assessments we needed to do, the more people we needed to administer them, but we also needed to make sure that they were doing it according to the manual and how they were intended to, specifically with the TOM. And so what we did here in New Mexico, we actually incorporated a calibration requirement for everyone that does the tools, or specifically the TOM. And we created videos of Wraparound team meetings, and the requirement is that everyone has to go to a calibration sessions once every 6 months. And we use the videos to actually create a standard for administering the TOM. We have what we call master coaches here in New Mexico, and they create a rating sheet for the video and for the TOM. And so people have to calibrate close to what the master coach would rate a TOM in order to have met that expectation of calibration. We're just starting that. We've gotten some good feedback. We're gonna keep doing it. But producing those Wraparound videos, I think, was something that we really enjoyed, and I would highly encourage everyone as well that if you can produce sample videos of Wraparound team meetings, I think there's a lot of lessons to be learned from doing that regarding our practice, and then it can be used to calibrate as well to assure inter-rater reliability. And then the third thing that I wanted to share with everyone regarding implementation is just about clarity and expectations about how to implement, when to implement the TOM, the WFI, and the DART. One of the one lesson that I want to share about this kind of goes back to the sample size and being able to have a good number of responses in order to say that you have a good sample representation. And we, like I mentioned earlier, we do cycles in a quarterly basis for a quarterly period. And what we would find, or what we're still finding some, but we were finding a lot, was that our providers were waiting till that last month of the quarter to complete the evaluations, like everything, the TOM, the WFA, everything that they were doing. And usually by that third month, either one, they weren't able to schedule a TOM, a team meeting was not going to be able to happen before the end of the month for when they had to do a TOM, or youth families had discharged from wraparound by that by the time of the end of the quarter, and so they weren't able to complete any of the assessments. So one of the things that we added into our implementation manual was clarity about actually asking them to complete proportionally all of the tools within a quarter. So basically in the first month, they have to have a third of them completed, second month, 2/3, and so on. But again, being very clear about those expectations is starting to help us to actually be able to complete all of our tools. And then I wanted to talk to you as well about individualizing the tools. Now, let me explain what do I mean, and I'll talk about that first point there about adapting the tool to fit the practice. I don't mean changing the tools. I think that we have great tools to measure fidelity, but I think that there is some room to be able to adapt them. I'll give you an example. When we're in the middle of starting the DART, and a few months back when we were going to when we were looking at the DART for implementation, we've noticed that some of the expectations in the DART did not match the expectations that we had developed for the wraparound here in New Mexico. We were actually a little bit more strict time-wise with some of the expectations and timeframes. And so we went to Dr. Bruns and his team and asked if we could incorporate language, New Mexico language, in some of the domains that would align to our New Mexico expectations. And they agreed. Again, we didn't change the tool. The tool was still measuring the same fidelity elements, but we were able to do some adaptations in order to fit our practice. And it speaks to our New Mexico facilitators because it uses the language that we would use and the expectations and timeframes that we would use. Now, talking about the fidelity, overall fidelity score and practice markers, and I'm going to combine also quality practices there 2 and 3 for the sake of time. When we started to implement the tools, we did it because we wanted to be doing fidelity, right? That's the sort of the objective. We know that when you implement wraparound to fidelity, you get those outcomes that you're looking for, those outcomes that make the difference. And so the tools offer that to us. However, we got sort of a tunnel vision, if you will, in looking at those fidelity scores and aiming for those fidelity scores. And we didn't realize that for some time that within those scores, there's some really good data as well. And for example, let's talk about the WFI. The WFI, even though you're looking for that 80% minimum score that tells you you're doing high fidelity, within the WFI, there's other elements such as outcomes and satisfactions, and you can either take the whole block of outcomes or specific measurements within outcomes, and it can tell you a lot about your practice. For example, has law enforcement been involved with that family? Has emergency services being used? Those 2 points can tell you a lot about your practice, and those 2 points make up the big overall score. Yeah. But one of the things that we started to do is look at those individual practice markers to tell us about the quality of our practice beyond just that score of fidelity. You can go to the next slide, please. And then we wanted to share a little bit about evaluation structure as a whole and a few lessons learned here in New Mexico. And one of those is to, as much as you're able to bring in experts as much as you can. One of the best ways that I have to illustrate this is when we started to do wraparound, there was two of us that were developing wraparound here in New Mexico, and we had a handful of providers. And we started to do a lot of data collection through Excel spreadsheets, right? And it worked, But as we grew, as we added data points, as we added new providers, it just wasn't possible to keep doing it through Excel. And so we brought in the University of New Mexico, specifically an area that has a lot of experience in data evaluation and developing dashboards and developing data plans and evaluation plans. And then eventually we also created a New Mexico Center of Innovation, and they have a lot of experience in coordinating trainings and developing curriculum, in tracking workforce development. There were things that one, we didn't have the capacity to do time-wise, but also we didn't have the expertise to do. And that's one of our lessons learned that we want to transfer to everyone, is that as much as you can, don't try to do everything. Bring in experts that can help you to develop your evaluation, your training, your curriculums, and then be able to do some other work for you as well. And then this question of whose need are you planning for is important as you're doing all of this, specifically your evaluation structure. Here in New Mexico, we have just gotten the approval to use Medicaid dollars to reimburse for wraparound as of July of 2023. Prior to that, we were doing wraparound through grants, and we were doing wraparound through some state general funds. And as you can imagine, those funding sources had their own requirements of what they wanted to evaluate and what they wanted their the outcomes to be. And so we found ourselves initially creating evaluation plans to meet those funders' needs, and which is fine, right? We needed to do that. But we eventually saw the need to actually create an evaluation plan that measure the outcomes for our providers and measure the outcomes for what we wanted wraparound to do here in New Mexico. So we had to kind of go back and rewrite some of our evaluation plans in order to meet the latter. Also, how is success measured? Kind of goes with that prior bullet point. We wanted to make sure the success was measured by how it affects families and what it does for families. In addition to meeting some of our funders' needs as well, like I mentioned earlier, right? But it was more important for us to know that we were making a difference. And so we kind of took a double approach. One, we kind of used a qualitative approach in defining what we were after. And we started to incorporate this language into all of our trainings, all of our flyers, anything we were putting out. And basically that wraparound was in the business of keeping families together, keeping children, helping children, youth being successful at school, keeping children in their communities close to their supports and their culture, helping families find hope and driving system change. And that kind of became sort of our qualitative way of how we were measuring success. And then in a quantifiable way, we developed key performance metrics. We developed specific points that we wanted to reach through our program. And going back to, bringing in experts, University of New Mexico right now, they're helping us to develop dashboards to be able to actually see those KPIs in real time, and for all of our providers to have access to that data so they also know how they're doing, if you will. And then data and coaching in this language of data, just a few lessons learned on that. In Wraparound,
once you're done with that point, we're going to need to move on to Danielle, so everyone gets their time before the top of the hour. Although we will go until 30 minutes past the hour for Q&A. So feel free to finish up this point, but I want to make sure Danielle's got time.
I'll go ahead and just go to the last point about teaching the language of data. One of the things that we are learning is that Supervisor coaches have a lot of zeal for wraparound here in New Mexico, and they can speak about the model, they can defend the model, they can give you a lot of anecdotal evidence to why wraparound works. But we've learned that their administrators, their executive leadership, that they speak this language of data, that they want to know how do we measure their work, and how do we know this thing called wraparound is working. And so we're starting to actually teach supervisor coaches at the frontline level this language of data, be able to know how to use their data and how to talk about outcomes to their leadership. And I'll stop there.
Well, sorry to cut you off because that was an amazing review of a lot of critical points and some great wisdom that we knew has been learned down there in New Mexico. But let's go to our last state. Again, we're going to go all the way to the end of the hour. We also are going to hear a little bit from our National Wraparound Implementation Center colleagues around ways that they collect and use data in the states they're providing training and technical assistance to. So hopefully folks can hang out for a little longer, but let's go to Danielle.
Hey y'all, my name's Danielle. I use she, her pronouns. I'm a white cisgender woman, and like Eric mentioned, I'm at the Portland State University in the School of Social Work, the Systems of Care Institute. And we have a contract with Oregon Health Authority to do training and technical assistance for all of the wraparound programs in the state, and it is a statewide initiative. So I'm gonna, I guess, try to talk really fast and go over some.
You just take your time, Danielle. This is all recorded, and more people will probably watch the recording than are here now. So, and most of the time, people hang out a little past the hour. So you just feel free to give us your whole story.
Okay, thanks, Eric. So I'm going to talk a little bit about lessons learned and kind of how we have things configured in the evaluation cycles, and then some things that we learned with the TOM 2.0 rollout specifically, and then how we use the fidelity reports for continuous quality improvement and coaching at the program level. So we have, like Illinois, we have one person at the state level who creates all the evaluation cycles, and that's me, just to make sure they're all set up uniformly. And we do fixed cycles. We distribute it across all care coordinators to make sure there's an even sample. Most programs do the WFI-EZ monthly. We do have some that do it bi-monthly or only twice a year. And then the TOM 2.0 is done twice a year. And we coach the wraparound programs to begin discussing fidelity tools and the CANs right at the beginning of phase 1 in the engagement process, and to kind of talk about it throughout the whole process. So when the time comes for a youth or family or team member to maybe be selected for one of the tools, that they're aware of what it is and kind of expecting it. And in terms of how the data is collected, each program has a person that's designated as a data partner, and they're usually someone who's doing administrative type tasks, or some of the smaller programs, it's their coach, is the person who's responsible for the WrapStat data entry and making sure that the WFI-EZ is being collected for their program. And then I kind of work with them if they have any questions. And then one of the things that we learned with the WFI-EZ cycles and trying to get better response rates is we usually coach people at programs that you want to talk to folks when they're first engaging in wraparound about what is the best way for them to receive the WFI-EZ, what's the most likely way for them to get it and be able to fill it out. Maybe they want to have you just call them on the phone, maybe an email or a text works for them, or maybe they want to fill it out on paper, kind of finding that out during engagement and then using that, remembering that, tracking that somewhere. So then if that person is selected, they get it in the way that they're most likely to complete it, rather than just like automatically sending emails out to everyone. And maybe that won't work for everyone. So Oregon began using the WFI-EZ in 2016. And Oregon Health Authority, I believe, did some consultation with WERT around timeframes, and it was decided that the WFI-EZ would be offered after a youth and family had been in wraparound for 6 months. So that's how we have everything set up in the evaluation cycles. And the hope is that if they've been enrolled in wraparound for 6 months, generally they will be in phase 2 or phase 3. So they will have experienced more of the planning process. And they'll be able to answer some of those questions about the team meeting process and their plan of care and strategies and that sort of thing. And then I'm just checking my notes here. For some of the smaller programs that have fewer youth enrolled, it can be really hard if their evaluation cycle only has 2 or 3 people in it, and then maybe only one of them fills it out, to get at that, you know, a sample that is reflective of everyone they're serving. And so for some of those programs, what we'll do is we will add and include youth who have been recently discharged, so that maybe if they didn't fill it out when they were in wraparound, it just gives them a second chance. If they do want to fill it out, maybe they'll get a few more WFI-EZs completed so that we can get that response rate higher. And then for the TOM 2.0, we want to make sure that we include teams that are in all phases of wraparound. So we have the minimum setting of 3 months. And all of the programs in Oregon do the TOM twice a year. And I'll start talking a little bit about our TOM statewide rollout. So we decided to start doing a staggered rollout in January of 2020. So you can probably guess that there was a little brakes put on the process there, with not being able to do in-person meetings and all of that. So it took some trial and error to get it set up correctly in a way that worked for all of our coaches. So if you haven't used WrapStat before, or if you have, you may know that that first evaluation cycle that you create, or the first few, they're going to be bigger because everyone is eligible for everything. And then as you go on, the samples will get smaller because folks have already been included in previous cycles. So we were having programs that had TOM 2.0 cycles that were, you know, like 45 or something, and they only have one coach. And we went back to coaches and talked with everyone. And a lot of the programs decided, we gave them a range, like, what do you think is realistic for you to be able to complete in a 60 or 90-day period? And so each program told me how many days they wanted their cycle to be for. So it could be 30 to 90 days. So how much time do they want to have? And how many youth do they want to have included in that? So it might be 10, it might be 25. And if a program happens to have 2 coaches, then they have a larger sample. So we just set up parameters that worked best for each program. And that helped a lot because it was really overwhelming at first, because coaches were like, there's no way I can do 40 TOMs in 30 days. So just be aware of like what the cycles look like, and maybe kind of play around with not actually going all the way through creating a cycle, just to see how many people it includes and get an idea about how that works. And then in terms of how we use the data and the reports, I meet with most programs quarterly. So I'll meet with the coach, the supervisor. Some programs include all of their like care coordinators, youth partners, family partners. And then sometimes it's just the coach or just the supervisor. And we review each section of the WFI-EZ Fidelity Report. Kind of like Arturo was talking about, it's not just the fidelity part to focus on. There is lots of great information even just looking at section A, that's like, is wraparound at its baseline happening? And then looking at outcomes, looking at satisfaction, and going over item level scores and key element scores for section B. And so we talk about looking at individual scores and how that gives you a better picture of what's actually happening rather than just looking at the averages and thinking everything's okay, but maybe you have one item that's skewed way off and you might need to focus on it. So really looking at all of those. And then we talk about what things are they doing really well that they can take back to their team and say like, hey, y'all, our natural support key element score went up this much since last quarter. You know, we're doing great work with that. And then also things that maybe they specifically want to work on with group coaching. If something comes up in one of the sections around like outcomes, or are people following up on their tasks between meetings, that sort of thing, then maybe they would build that into group coaching. And so, yeah, we do that quarterly. And it's been really great to see people kind of understand that like continuous planning and like try and tweak kind of thing. And it's been great to see like the development over time in programs looking at that information. Yeah, so that's all I have.
Well, that is just amazing, folks. And also just of note, we only lost about 10 or 15 folks. We still got 120 people on the line. So with that, I can't see myself because I was told to close all of my windows, but maybe you can see me. I'm gonna move over to our discussants. In 1 minute, I'm seeing that Kristen has said, there's another question in the Jamboard about if families know what you mean when you ask them about the wraparound program. Do they get it mixed up with other services or programs? Maybe start with Danielle around that one, because you were talking about ways of trying to identify which method they would like to be surveyed and so forth. So, no, any thoughts about that, Danielle? I know we've heard that from a lot of different places out there.
Okay, I think some families might know, but initially part of phase one, right, with the care coordinators is that they're explaining all of the ins and outs of wraparound and explaining how it's different than a lot of other programs or services they've had, and it's principles driven, and we're focusing on, you know, having the end in mind and really bringing in natural support. So they might get it mixed up at first, but really the whole intent of that engagement phase is showing them how and why it's different.
Right, which might prompt them around what it is this survey is, or these questions are that they're getting after 6 months in the initiative. Tammy or Lydia or Michelle or Arturo, anything else you'd add about how you make sure that families, when they are receiving their surveys, understand what it is they're being asked to comment on or rate?
Hi, this is Michelle. I would just say, as I said in my presentation, we really emphasize family voice at the very beginning of our wraparound process. And so we just talk about it enough that we feel like our families understand by the time the surveys or people come asking them questions for their input, they're like, oh, this is what you meant by family voice. And it's not so scary or intimidating.
Very cool. Yeah, and some folks may know we're trying to develop a method of using text-based links to very, very brief versions of the Fidelity Index surveys that we will eventually be looking to lean on to get better response rates, and that also provide opportunity for, as was described by some of our panelists, the care coordinators to really emphasize how you getting these text messages and giving us feedback in real time is part of what we're trying to do with you and your family, is know in real time how this is working for you and what kind of outcomes you're experiencing. So over the next couple of years, be looking for ways in which we're beginning to try to bring that into the process of getting input from families as well. So I will move now to our NWIC colleagues. We still have the vast majority of our attendees with us. So tell us a little bit about what you have heard and ways in which you would like to kind of reflect on these 4 states and what you see nationally around use of data that keeps Wraparound on track.
Great, thanks, Eric. So one, I think it's great that states are really attending to the data. I mean, Eric, how many times do we say, this data and this information, the quality of wraparound matters. And I think too, and I don't know, Eric, if you want to advance the slides or if you just want me to talk, I'm not really sure where that landed, but, and you can click it all in. I don't know, can I do it? I can't do it.
I'm clicking it. We're building a strong wraparound house with data. So you want me to go?
We are. And it's certainly built from those foundational principles. I think, I believe it was Arturo that talked about the elements being clearly defined and, how do we set expectations for providers around what we're looking for? And you can just click all those in, Eric, if you want. And it's all true. It's all great. We've actually talked a lot about those ongoing continuous quality improvement pieces. The fidelity monitoring obviously is what we're talking about. But what we also know is that the house that Wraparound sits in matters, and that the system that it sits in matters. And so we've developed a couple of tools actually. The Wraparound implementation standards for the state or system and Wraparound implementation standards for the program or provider, because we need to understand, if we're not getting the fidelity or the quality of wraparound that we would like, how do we know what's impacting it? And I don't think that the burden of wraparound sits with the care coordinators alone, right? It does not. And a little tidbit I'll throw out is that we're starting to look at some data, and we think that maybe the system expectations, the system structures, meaning how it's financed, are the expectations clear? Are monitoring and oversight associated with wraparound, is it a standard as part of the state system that might actually matter more than at the provider level, but it's still early. But what we know is that providers will do, what states expect of them. And that if we can combine all of these efforts, right? Like if we can align across a clearly defined practice model, support for the workforce, the fidelity monitoring embedded in a robust evaluation plan, and with states and providers that are set up to support this work, you can actually achieve really positive outcomes for families and for systems. And so, I think Michelle talked about, the state of Illinois and how are we setting the bar for some of this. And so it's really exciting to see all of those different levels of work being done. And then I don't know, Sarah, if you wanted to add anything around what you've seen.
Yeah, so in case you haven't used these tools, the Wraparound implementation standard at that state system level or the one at the provider program level, we're seeing, states use it in combination with the DART that was referenced earlier, or combination with the, the WFI-EZ or the TOM, and really trying to understand not only at that program provider level, but at that state system level, okay, what is that missing piece? So some of the things that the WIS-S or the WIS-P, looks at are looking at leadership structures, looking at the involvement of management and leadership, both at each level. What are some of those financing pieces that are coming into play that may be affecting the, the staff and the personnel at that practice level? So really trying to look at overall, what are all these different pieces? And yes, looking at fidelity, but also just how close are we to what was originally intended to be implemented to meet the need for youth and families.
Yeah, and in fact, so thanks for those reflections. We'll come back to you to see if you have any other thoughts. But, we've done research, and it's largely thanks to the fact that we have this incredible community of practice that we were able to look at states that had one kind of organizing and financing wraparound versus states that used a more traditional approach. So states that use care management entities where there's a locus of accountability and workforce for care coordination. Our fidelity tools and the coaching tools that NWIC uses were found to be more positive, to be stronger with respect to fidelity and skills in the states where we see the system has set itself up to be more reflective and more accommodative of wraparound principles. So it makes all the difference. And we wanted to make sure we brought our NWIC folks in to talk about this because we believe that all of these aspects of implementation are important to measure. The outcomes of the kids and families are first and foremost to make sure you know how well you're doing. But we know fidelity affects outcomes, and we have increasing understanding that it may indeed be the state system, something that is also measurable using these tools, for example, that Kim and Sarah are talking about, or other tools, including our community sports for wraparound inventory, which we didn't talk much about today, but that's another way you can get at the system and program adherence to wraparound standards. Maybe Kristen can provide, I would try and do it, but I'm afraid of breaking my screen share. But maybe Kristen can provide a link to or someone else to the wraparound program and system standards that the NWI has. These are critical to measure and to keep track of as well. So it's fantastic that we still have so many folks. One thing I want to let Arturo unmute and let folks know that indeed how success is measured in New Mexico, as an example for others perhaps, is available to be shared. Arturo, any way around, what would you think would be the best way to share that with our attendees and maybe the whole National Wraparound Initiative community of practice?
It's within our implementation manual, which is within our website. I'm kind of realizing that we probably need to bring it out more, but I can put that together and send it your way, Dr. Bruns, for that we can forward to anyone, everyone.
That sounds fantastic. So we will send that out to all of our attendees. And I would go so far as to say that as a postscript to this fantastic webinar, thanks to all of our panelists, we will also make that available on the National Wraparound Initiative website if Arturo is agreeable to that, because I think it sounds like it'd be a great resource for folks to see, as well as a great example of how every state innovates in their own way. And that's one of many ways that New Mexico has done this for their own state. So Kristen, do we have anything else on the Jamboard that I would love to bring it up, but again, I'm afraid of breaking everything. Here
That's all we got on the Jamboard.
All right. Well, we have a resource list that will also be available in the slides, which will be posted on the National Wraparound Initiative, and that you can find at any point. But again, I think I might have to do a little postscript on the NWI about this amazing webinar, let folks know the recording is up, and provide access to resources from our 4 panelists and our 4 states, such as New Mexico's How Success is Measured resource. So Sarah and Kim, any final thoughts or words about measuring and using data to try and stay on track from NWIC?
Keep doing it. Do more of it. Can I say that enough? Keep doing it. Do more of it. And I would also really encourage you to look at, the system aspects and play an intermediary role between the frontline workforce and your state or leadership in your organization around what are the things that are supporting the care coordinators to do this work. It's not necessarily the easiest. I mean, these are young people with really complex behavioral health needs and their families. And so, we just want to make sure that we're doing everything that we can to ensure that the help that families receive is helpful. And all of the data in the world can help with that. It's not the only thing, but it's a big part of it. To manage by data instead of feeling, fact instead of feeling.
Beautiful way to end our time together. So thanks everyone, and be on the lookout. There will now be a link to an evaluation of this event. We try to walk what we talk and use data to improve our own work. So please click on that Qualtrics link before you close out. I think you're also going to get that in an email. We would love to hear from you. Qualitative feedback on what was useful and what you would like more of. We use that information from our community of practice. So please fill that out, and don't hesitate to write us with any follow-up questions at rapeval@uw.edu. Thanks everyone, and have a great rest of your week.